Hello viewers, I am Dr. Lieutenant Colonel P. Prabhakar. I am Associate Clinical Director and Head of the Department of Orthopedics, Care Hospitals, Nampally. Today we'll be discussing something about shoulder pain. Quite a few patients present to the OPD with common symptoms of excruciating pain around the shoulder with restricted movements. Now these are things which cause problems in performing their activities which require either the normal functions which do happen or otherwise occupational limitations. Common presentations which we know are shoulder pains associated with restriction of movement. Now these movements are common symptoms which present in terms of reaching out for overhead objects which may be problematic, taking the shoulder joint towards the back or lifting of objects. All of these may contribute towards some amount of aggravated symptoms. Now how do we diagnose in terms of what is it that we do? By and large, clinical examination is mandatory. We will like to see if the condition is also accompanied by some kind of a degenerative pathology. So a mandatory investigation in the form of an X-ray is required. Of course, in certain other conditions of post-traumatic situations, we may require MRI evaluation of the shoulder to diagnose a rotator cuff tear or any impingement kind of syndromes. Depending upon what we find on clinical examination, there are treatment options available. By and large, in terms of periarthritis, where there is restriction of just abduction, which is trying to lift the shoulder, and rotation movements, these contribute to a large amount of disability. By and large, they may be accompanied by patients who are diabetics and hypertensives in whom this presentation may be accelerated. So, primarily, control of blood sugar levels are mandatory. Secondarily, some amount of painkillers, muscle relaxants are required to alleviate pain symptoms. Thereafter, physiotherapy forms the mainstay in terms of helping us to regain the lost shoulder movement. So, a cycle of physiotherapy, by and large for about 3 weeks, is tried and initiated. After which, if in case these patients do not respond to standard physiotherapy care, surgical options may be explored in terms of either manipulation under anesthesia, which does help in a lot of times, and subsequently, if it is completely resistant to any of these methods, arthroscopic release of the shoulder joint is something which has shown very good results. Second, of course, is in cases of a post-traumatic situation where there is a cuff tear. Now, in terms of a cuff tear, we do find some amount of a history of an acute event, wherein there has been a history of fall, following which there is a sudden inability of maintaining the position of the arm vis-a-vis the shoulder. Also, difficulty in lifting movements of any kind also may be one of the presenting factors. Apart from these, there are degenerative conditions which may precipitate towards a supraspinatus tear, which may also present symptoms. In these cases, an MRI evaluation is something which is mandatory. Following an MRI evaluation, if the diagnosis of a cuff tear is confirmed, the treatment option is largely surgical. In today's age, with the advancement of various surgical techniques, open surgery is no longer considered to be an option. By and large, we can tackle all of these conditions by arthroscopic repair. The arthroscopic repair means that we just use a keyhole type of a technique for the surgical procedure itself, repair the tear, and the advantages being that the patient's morbidity is much less and recovery from the surgical part is extremely fast. Also, coupled with the fact that it is cosmetically much more acceptable, so it has found much more wide acceptance as far as the patients are concerned in today's age. If there are any further queries with regards to shoulder pain, you can visit our clinics and we could probably help you out with whatever condition or symptom that you're facing. Thank you.